Yeah, it started out slowly. I now refer to this as the caregiver creep. I think it's quite common. Our parents start to age, they need more and more support. We just think we're being good daughters and sons, helping them out, but we've actually taken on a whole new role. And we don't yet know that we're caregivers. We don't identify as caregivers, but that's what's happening. So that went on for a couple years. And then we hit our crisis point. And for my family, the crisis was my dad being diagnosed with Alzheimer's and my mom was stage 4 ovarian cancer on the same day. It was intense. And so all of a sudden, how do I care for these two parents who are so sick? How do I continue to go to work when I can't afford to take unpaid leave? And how do I continue to be hopefully a good mother to my kids? And so I started Working Daughter because I didn't want anyone else to ever feel as alone and as unprepared as I did. And I wanted to make sure that we get caregiving and career to become compatible because it wasn't for me so many times and it still isn't for too many people.
Hey, this is Jonathan Marks from Go To Health Media. How are you today? Welcome back to another show. Nearly half of U.S. states are on the brink of an unpaid family caregiving emergency, according to findings from a new study conducted by Columbia University Mailman School of Public Health and sponsored by Otsuka America Pharmaceuticals. The study shows unpaid family caregiving is either critical or at high risk in 24 states. The shrinking healthcare workforce and a rising prevalence of dementia is putting more pressure on the approximately 40 million family caregivers in America today. The research found family caregivers are performing an estimated value of $873 billion worth of labor each year, most of which goes unpaid. With us today, we have two guests. Dr. John McHugh is the author and lead researcher of America's Unseen Workforce, the State of Family Caregiving. Dr. McHugh is an associate professor at Virginia Commonwealth University, and he's also an adjunct assistant professor at Columbia University Mailman School of Public Health. He will share his expert findings around the national unpaid family caregiving crisis as a result of the healthcare workforce shortage and rising dementia cases. Our second guest is Liz O'Donnell. She's the founder of Working Daughter, a caregiver advocate and former caregiver to both her parents and her husband. She provides timely insight into the current caregiving landscape and can explain why now more than ever is the time to establish a standard of support for family caregivers. So welcome to the show today, Dr. McHugh and Liz O'Donnell. How are you both?
Great, thanks.
Doing well, thanks. Thanks for having us.
Good. So, John, let me ask a couple of questions and then we'll go to Liz. What's the state of unpaid family caregiving in the United States today? How does it vary across states? Tell us about the report that you authored.
Yeah, so this was research that was done at Columbia University and sponsored by Otsuka. And we really wanted to make the invisible visible and highlight the immense contribution that family caregivers are providing to our healthcare system. We actually found that in 24 states, nearly half, unpaid family caregiving is either at a critical or at a high risk level. And to put this into some context, let's take Florida, for instance. In Florida, family caregivers are contributing the equivalent of $60.6 billion annually.
Wow.
Now, in comparison, Walt Disney World has an economic impact of about $40 billion.
Wow.
So far exceeds Walt Disney World. So we really hope that this report will serve as a tool to assess the family caregiving landscape at the state level and inform decision-making and political advocacy.
And what's the crisis that we're reaching, John? Can you describe what's the crisis?
Yeah, so there's a few factors that are leading to the increase in caregiving. So first and foremost, we have a lot of pressure that's being placed on the long-term care workforce. So finding just sheer numbers of paid workers, but also high-quality workers. Second, we have an aging population, and an aging population where older adults have many more comorbid conditions than they have in the past.
Sure.
And then third, there's a rising prevalence of dementia care. Dementia care is much more intense, time-consuming, and emotionally draining than other types of care. And we actually found that dementia attributed nearly half of our total valuation at $340 billion. And if 10% more caregivers cared for a loved one with dementia, the total valuation would increase by $62.3 billion.
Incredible. Well, Liz, can you share your personal caregiving experience and how it inspired you to become an advocate?
Yeah, it started out slowly. I now refer to this as the caregiver creep. I think it's quite common. Our parents start to age, they need more and more support. We just think we're being good daughters and sons, helping them out, but we've actually taken on a whole new role. And we don't yet know that we're caregivers. We don't identify as caregivers, but that's what's happening. So that went on for a couple years. And then we hit our crisis point. And for my family, the crisis was my dad being diagnosed with Alzheimer's and my mom was stage 4 ovarian cancer on the same day. Same days. Yeah.
Oh, how
Yeah.
difficult. Wow.
Yeah, it was intense. And so all of a sudden, how do I care for these two parents who are so sick? How do I continue to go to work when I can't afford to take unpaid leave? And how do I continue to be hopefully a good mother to my kids? And so I started Working Daughter because I didn't want anyone else to ever feel as alone and as unprepared as I did. And I wanted to make sure that we get caregiving and career to become compatible because it wasn't for me so many times and it still isn't for too many people.
I was going to say, how do you make it compatible? Is there a way? I mean, caregiving for your parents or a loved one takes a lot of time and care.
Yeah, I think there's a lot that the workforce can do, and I think there's a lot that already exists in the workforce. If you look at companies' benefits packages, if you even look at your health insurance policies that maybe you get through your employer, oftentimes there are employee assistance programs in there. There's access to backup care. There's, flexible work schedules. But these need to be so much better communicated because the caregiver is too overwhelmed to even know what to ask for. And then,
Yes.
just a message to caregivers is literally this job takes more than 24 hours a day. So, I think we try so hard to be perfect. We beat ourselves up for what we can't do. But my wish for caregivers is they would acknowledge what they are doing as
Yes.
opposed to feeling bad about what they're not.
Yes. So, John, Liz has described some of the challenges of family caregiving. Can you add to that and what's happening with the workforce shortages? How is that increasing the demand for family caregiving?
Yeah, I think the workforce shortages are having a huge impact on caregiving. And what's interesting is that it's exacerbated even more in rural areas. So think about a state with an urban and rural population, and a lot of the formal care workforce is going to be concentrated into the more of the urban areas. So we found that more than $375 billion, nearly half of the total valuation, was distributed across the 32 states that have a greater percentage of their population living in rural areas. So in these areas, you have shortages of long-term care workers, but you also have a more rapidly aging population and most likely less access to family that lives close by to help out with the caregiving demands.
Yeah, this is a constant theme. We're starting to hear about difficulties in rural healthcare, distance to hospitals, hospitals closing, the distance that you have to drive or get to get to care. So family caregiving, especially in a rural area, is going to become even more critical.
Absolutely.
Yeah. So let me ask you both, what types of solutions could be most helpful to unpaid family givers?
So I think starting at the federal level, investing in the long-term care workforce. So that could include better training, higher wages, building the numbers back up, finding long-term solutions for the staffing challenges. And this goes both institutional and community-based. So our long-term care facilities also need support in terms of staffing. And then at the state level, advocating for funding to support unpaid family caregiver programs. So that may be financial assistance. It could be training. It could be access to respite care. All of these things that can really help to support caregivers.
Got it. And Liz, tell us a little bit more about Working Daughter. What does Working Daughter provide?
Yeah, so to the individual caregivers, we provide community, content, and some coaching. Right now people are going through this alone, and I always say it should be a team sport, right? And so through our community, people can reach out to other caregivers online and learn from them and vent to them and lean on them. So I think that's really important. And then the other thing we do is we go into the workplace to try to help companies support and retain caregivers, and we do that through training and consulting.
Great. So people can learn more at otsuka-us.com/caregiver. I'm going to spell that so people can get that correctly. It's otsuka-us.com/caregiver. otsuka-us.com/caregiver. So as we end the interview for today, both John and Liz, I'd like to ask each of you, what's the important message you'd like to leave with our audience today? What do you want them to know about family caregiving as they consider their own lives and families?
Well, my message is to the individual caregiver to give yourself permission to value your own life at the same level that you value the life of the person you're caring for. And so if that means that you need to take time to, earn a paycheck, to be there for your children, or to attend to your own well-being, you need to give yourself permission. You have my permission to do that.
Yes, and that reminds me of what they tell us on the airlines every time is if there's no oxygen, make sure you put on your own mask before you put on the mask of another person.
Right, exactly.
John, what message would you like to leave with us today?
Yeah, I think first and foremost, to caregivers, you're not alone. There are 44 million people that are providing care to their loved ones. And then to policymakers at the federal and state level, we need the support. We need to elevate this in the national conversation so that we can come up with the solutions necessary to support caregivers going forward.
Good. I want to thank both of you for being with us today. We'll do our best to get the word out about this important topic. We've been talking with John McHugh, MBA, PhD. He's the lead researcher of, quote unquote, America's Unseen Workforce, the State of Family Caregiving. It's the latest installment in Otsuka's research series, which highlights the essential contributions of unpaid family caregivers. He's an assistant professor at Virginia Commonwealth University, and he's also an adjunct assistant professor at Columbia University's Mailman School of Public Health. And Liz O'Donnell is a former caregiver for her mother, as you heard, her father, and her husband. She founded Working Daughter, an organization that provides caregivers with the tool to manage their roles, working and caring. She's also the author of 2 books, Working Daughter, A Guide to Caring for Your Aging Parents, and Mogul Mom and Maid, The Balancing Act of the Modern Woman. Thanks so much for being with us today, both of you.
Thank you.
Thank you.
And thank you, our audience, so much for being with us today. We're so glad you're with us. We've just passed 1.4 million downloads from our over 150 shows that we have produced. We have 2 goals: to bring evidence-based health information to the public from medical experts, and to support these experts in getting out their information with multimedia campaigns. We'll see you again next time. And remember, as we say at the end of every show, go to health. Take care. Bye-bye. Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marks in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at gotohealthmedia.com. See you next time, and remember to elevate your life with Go to Health.